An overview of tuberculosis. Tuberculosis is an infectious disease caused mainly by the Mycobacterium tuberculosis. TB usually affects the lungs, pulmonary TB, but it can also affect other parts of the body or organs such as the brain, spine, kidneys, lymph nodes, bones, abdomen, and the skin. When TB spreads outside the lung, it is called extrapulmonary TB. How TB spreads. TB spreads through the air when a person with active TB cough, sneeze, talk, or sing. Tiny droplets containing bacteria are inhaled by others. Now, TB does not spread by handshake, sharing food, touching surfaces, sexual contact, or by mosquito bites. Now, there are two types of TB, being latent TB, then active TB. Now, with latent TB, TB bacteria are in the body but inactive. No symptoms, no contagious, not contagious, sorry, can become active later. But active TB, bacteria multiply and cause illness. Symptoms are present and can spread to others. Risk factors, people are at higher risk. People at higher risk includes people with HIV/AIDS, diabetic patients, smokers, alcohol abuse, malnutrition, cancer patients, people taking immunosuppressive drugs, healthcare workers, people living in crowded places, elderly individuals, infants, and children. Now, symptoms of pulmonary TB. Common symptoms include persistent cough lasting more than 2 to 3 weeks, coughing blood, chest pain, fever, night sweats, weight loss, loss of appetite, fatigue, and shortness of breath. Symptoms of extrapulmonary TB. Let's say if you have TB affecting the brain, the spine, the kidney, and the lymph node. With the brain, there's headache, confusion, and seizures. With the spine, there's back pain, deformity. With the kidney, there's blood and urine. Then with the lymph node, there's swollen neck nodes. Now, TB in children. Children may have poor weight gain, fever, persistent cough, reduced playfulness, swollen lymph nodes. TB can become severe quickly in children. Now, diagnosis of TB. How can TB be diagnosed? Sputum test, chest x-ray, gene expert test, tuberculin test, blood test, CT scan or MRI. Now, TB and HIV. TB is one of the leading causes of death among people with HIV. HIV weakens immunity, making TB more likely to become active. TB/HIV co-infection requires treatment for both conditions. Now, there's drug-resistant TB. That's multi-drug resistance, resistant to isoniazid and rifampicin. Extensively drug resistance, more severe resistance pattern. This is caused by incomplete treatment, wrong medication, and poor adherence. Now, treatment of TB. TB is curable with proper treatment. First line TB drugs are, we have an acronym which is ARIPE, which stands for rifampicin, isoniazid, pyrazinamide, and ethambutol. Now, treatment usually lasts 6 months for standard TB and longer for resistant TB. Now, the mechanism of action of TB drugs. One is isoniazid. It inhibits mycolic acid synthesis in bacterial cell wall. Rifampicin blocks the bacterial RNA synthesis. With pyrazinamide, it works best in acidic environment inside infected cells. With ethambutol, inhibits cell wall formation. Now, side effects of TB drugs. Isoniazid, peripheral neuropathy, liver toxicity. Vitamin B6 is often given with it. With rifampicin, orange red urine and tears, liver damage. Pyrazinamide comes with joint pain, hyperuricemia. Then ethambutol comes with vision problems, color blindness. Now, TB treatment phases. We have intensive phase and continuation phase. Usually first 2 months using 4 drugs for the intensive phase, then continuation phase remaining months using fewer drugs. Importance of completing treatment. Stopping treatment early can cause relapse, drug resistance, spread to others, then severe diseases. DOTS strategy. DOTS is directly observed treatment short course. A healthcare worker observes the patient taking medication to improve adherence. Complications of TB. Untreated TB may cause lung destruction, massive bleeding, respiratory failure, meningitis, infertility, bone destruction, and even death. Now, TB prevention. There's a BCG vaccine given in many countries to protect children from TB. Good ventilation, fresh air reduces spread, and mask useful in healthcare settings. Early detection and treatment, most effective prevention. Then treating latent TB, prevention, it prevents active disease. Now, TB and smoking. Smoking damages the lungs, it increases TB risk, then worsens outcome. TB and diabetes. Diabetes weakens immune defenses and increases TB risk. TB around the world. TB remains one of the world's major infectious killers. Countries with higher burden often faces poverty, overcrowding, limited health care access, HIV prevalence. Important medical terms. Hemoptysis. There's coughing of blood. So if you see hemoptysis, or if you are suffering from TB, or if you are diagnosed of TB and you see hemoptysis in your symptoms, it's about coughing of blood. It's a term for coughing of blood. Now we have syncytin granuloma, which is classic TB tissue finding. Acid fast bacilli is a TB bacteria stained red with special stains. Now, pathophysiology of TB. After inhalation, bacteria enters the lungs. Macrophages ingest bacteria. Immune response forms granulomas. Infections becomes latent or active. Classic TB findings. Chest X-ray may show upper lobe infiltrates, cavities, then fibrosis. Histology, granulomas with giant cells, central seizures, necrosis. TB and meningitis. A dangerous form affecting the brain coverings. Symptoms is headache, neck stiffness, fever, confusion, then medical emergency. Now, TB in pregnancy. TB treatment is usually continued during pregnancy because untreated TB is dangerous for both mother and baby. So